5-minute talks. And so for our first talk, we have Saher Jabeen from TU Delft with a 5-minute talk.
Hi, everyone. Most of you already know me as a cruel pusher, but that's not all I do. So actually, I mainly focus on preventing the falls. So every minute, there is an elderly individual in an emergency room due to a fall event. And most of the falls occurs due to tripping, slipping, or stepping down. And today I want to let's take a small review on what actually tripping is and how the healthy individual really recover from the tripping. So for recovering from a tripping, we need a compensatory stepping, which lead us to the effective balance recovery, which involves the direction, the timing of your stepping, and also the amplitude of the step you take. And that mainly I would like to focus on that compensatory step, that if you are tripped in an early swing phase, here someone gets tripped, so we have a push-up force by the stance foot, we get the clearance from the obstacle, and with the help of hip flexion, what we do is we increase the step length to increase the base of support. So that's what an healthy individual can do actually. But what happens in the older fallers, their inability to perform these compensatory steps effectively. And that becomes because of their inability, comes from their delayed response times and also the low muscle strengths. So what if we would like to actually help them or assist them to perform the compensatory steps effectively? So for that one, I would like to focus on actually helping them in flexing the hip to increase their step length in a timely manner. So if we look at the conventional methods, the exoskeletons, we have quite nice exoskeletons out there. Also, we have also looked one in this conference, which is the soft hip exoskeletons. They can actually provide assistance to the hip joint, but what exactly the exoskeletons can provide you, I would call as a joint moment. In case of a hip torque, I would like to have an assistive moment acting on a thigh, and there would be a reactive moment acting on the upper body. Well, that should be there. We need an action and reaction. So do you see a problem here actually? So this assistive moment would actually eventually help to flex the hip, but that reactive moment is actually pushing the body forward, which is already falling. So we were thinking, okay, why not we actually get something which is without the reactive moment, in which in some cases it might not be actually, may have some negative effects. So how about having a free moment, only the assistive moment? And that actually is possible by using momentum exchange devices such as single gimbaled gyroscopic actuators. So these actuators are capable of providing free moment, which means you can provide or apply moment on the required limb without having any reactive moment on the adjacent limbs. So to test our hypothesis, I performed some simulations. So I'm using a simulation tool, SCONE, which is developed by Thomas Gittenbeek, and it's based on the 2D walking model developed by Geyer and Her, in which I can actually make the model trip with an obstacle, and I can apply the free moment and the assistive and reactive moment in terms of the joint moments, and to see how it actually gives us results. So the preliminary results, in which actually you can see the blue one is for the hip flexion, and this is actually without any assistance. So the model trips and falls. The green one shows when I applied actually the free moment on the thigh to flex the hip or increase the step length, and the red one is when there is a joint moment assistance. So we could actually see that both the joint moment and free moment resulted in similar hip flexion. So why one is actually falling and one is actually recovering and keep walking? So that difference actually comes from that what we saw as a reactive moment acting on the upper body, which resulted in increased leaning angle of upper body. So here, the green and the blue one, the no assistance and free moment, and the red one is the joint moment assistance, in which we can clearly see the increase in the upper body angle. So that what led that assistance with the joint moment and for the model to eventually fall. So here we could conclude with our preliminary results that the free moments applied on the thigh might be more effective than the hip joint moments to assist balance after tripping. But we have to be a bit careful in our conclusion because this is just model-based results and it used a 2D walking model. And so at the end, I would also like to mention some of the limitations here. So it's not always the case that the joint moment would be the best as compared to the joint moments. In fact, actually in some cases, such as knee flexion, actually the joint moment might be more effective than the free moments. Also, we have to look at the attachment of the device. Using the free moment, just small gyro actuators might not require actually the complex structures like exoskeletons, but it might be actually get a bit trickier to fix the device firmly on the limb without having big structures. Thank you so much.
Questions? Adam.
So if this applies a free moment to the leg, and that is going to rotate the leg is actually linearly accelerating forward as a result, and that's because of a joint reaction in the hip joint. So does that have any notable effect on the stance leg behind it, the fact that you're pushing backwards on the hip with the swing leg you just actuated?
So you mean that we have like a free moment on this leg, which is actually the swing one, but it might have the reaction caused on the other leg on the stance one?
It in fact must.
I haven't really looked at that one, but yeah, with the simulation, I would wonder that how precise it would actually let us allow us to see the effect on the stance leg.
How heavy would the thing need to be to provide meaningful assistance?
So currently we do not have a prototype, but what we are expecting is to have something, the meaningful assistance of a couple of Newton meters or at least 10 Newton meter. It might be as heavy as 500 grams to 700 grams.
5 to 7 kilograms?
100 grams.
100 grams.
Yeah, less than 1 kilograms. Yeah.
One more question?
You chose Geyer and Hers 2010 model. Is that the version with reflexes in it?
Yes.
So do you expect that the reflex topology of that model influences your conclusion?
Yes. That's why we are not really like, and that's what I was actually expecting, that those reflex model and they may actually have affected the results. That's why we are not really making a statement out of this.
It would be fun to play with the reflex topology to see how it influences the response as a way to system ideation.
And if you would like to play with it, right, want to feel what really free moment is, I have a toy gyroscope. So I can make it working for you to really feel the free moments.
Thank you.
Thank you.